Welcome to The Whole Pineapple. I'm Ruby Boris.
And I'm Ann Judge. The Whole Pineapple is a podcast about wellness focused around fertility. We'll talk with experts on a wide range of topics, including nutrition, stress relief, sleep, mental health, etc.
And we'll dig into the issues that can cause fertility challenges, like PCOS, or early menopause, or cancer treatment.
So if you're curious about your fertility, whether you're ready to start a family,
or you're preserving your options for the future, let's dig in. Welcome back to The Whole Pineapple. I'm Ruby Boris.
I'm Ann Judge.
And we've finally, I feel like it's been forever, have a nutrition and wellness episode coming at you.
Yeah, I know. It's season 2. We kind of pushed down all of Ruby's nutrition desires. So we're like, let's just talk about fertility things. But we are a wellness and fertility, and we are super happy to have one that gets a little bit more onto the wheelhouse of Ruby's favorite things, not just mine.
Yeah. Well, there's just so many, topics to cover that sometimes we go in more of the fertility direction. And today, actually, the topic is talking about how we really should be focusing on things in a more holistic type of manner. So I'm going to introduce our guest who is an expert in all of these things. So Katy Bradbury is a registered nurse and nutritional therapist. She's the founding member of Fertility Nutrition Center and clinical advisor of FabFertile, content provider for women's health platform Xena, and clinical supervisor for nutrition therapy students at the University of West London. You can find her on her website, katybradbury.com, and she has a back catalog of episodes from her podcast, Fertility in the First 1,000 Days. And she sees people in private practice. Welcome.
Thank you so much for having me.
We love getting these international episodes, except for the time zone scheduling. So thank you for being able to be with us in your evening while we're in the middle of our day.
Oh, you're so welcome. Yeah, it's a pleasure. And we've been trying to arrange this episode for a while. It's been a long time coming, hasn't it?
We've had all the things happen. We've had jury duties and scheduling conflicts and vacations and like anything else that could possibly be thrown in there. Well, I think we should just start off in like your background and how you got into this.
Good question. Yeah. So I guess like quite a lot of people who come into the field of fertility, I struggled to get pregnant with my firstborn. So I went on my own fertility journey for several years, and what that looked like for me, perhaps not in terms of the story as such, but in terms of how it felt, was just so incredibly demoralizing. And I just remember waking up every single day and just feeling depleted and low, and like there was something missing from my life, actually. And it was really, really hard. And even now, when I think back to that time in my life, it was really, really difficult. And when I came out of the other side of that, I decided to commit my career to it. And I was already a registered nurse. I'd worked in the field of women's health for quite a while. So I'd worked in gynecology, is where I started my career.
That's even harder than when you have fertility stuff, because you feel like, I know about this. I'm an expert in women's health. So
it's very ironic feeling sometimes. You're like, really?
Right. Yeah, exactly. And then where I was working at the time when I was trying to get pregnant was over here in the UK, we have a role called a health visitor, which is a nurse who goes and visits new mums at home.
Oh, so you're doing all the baby visits and the mums. That's so hard.
Oh my gosh.
Yes.
That hurts my heart.
And so it was working, and actually the role that I was doing at the time was a role where we were working with young women. So I was working with young first-time mothers. And so a lot of the people who I was working with were like just, getting pregnant like that, right? When you're 18, you're super fertile a lot of the time. And so, these were young women who were often getting pregnant by accident. And, it was hard because I was there. My job was there to support these young women. And I had so much, love and respect for them. And at the same time, for me, my heart ached. And, I really, when I did thankfully come out the other side of that, and I was focusing more on my nutrition career, I found out about this course, which is a year-long program to specialise in fertility nutrition specifically. And I jumped straight on it. I was like, that is what I need to do. That is what I need to do, because I feel like now that is my calling, to support people with what I went through. And that's more or less what I've been doing ever since. So that's in a nutshell, that's my journey.
If you don't mind me asking, because I always think it's so fascinating when I talk to people from other countries, what is the system like in the UK? Like, is fertility testing and treatment covered? Do you have to wait a long time? What was it like for you, even as someone that was in the healthcare system and kind of knew what to do?
Yeah, it's such a good question, and I'm always fascinated here as well. It's really variable is the answer, and it's a bit of a postcode lottery in terms of fertility treatment. There isn't a uniform policy across the country. There's guidelines over here. We have there's something called NICE, which is the National Institute for Clinical Excellence, and so they produce a lot of guidance based on kind of available evidence, etc. And in the NICE guidelines, at present, it does say that women should be entitled to 3 rounds of IVF, but the reality is every single area that you live in, every single local authority will have its own budget and its own policies, and so what that looks like is really different. So some people do get the full 3, some people only get 1, some people it's dependent on their age, or if they're a certain BMI, or if all of these kind of hurdles to jump through. And for some people it's a year, 18-month long waiting list before they even get seen for their first consultation. And if you're in your late 30s, then we know that one of the biggest factors is that ticking clock once you hit that stage. And so it's really tough. And lots of the women that I work with, because I work not just in clinical practice, but I've run support groups as well, and so I've seen and spoken to so many women, and one of the biggest hurdles is over here is the waiting game, and really feeling like time is running out and there's just nothing you can do.
It is interesting, like having worked here for so long, I remember when I started how it was rare to have someone that had fertility coverage with their insurance. And at first it seemed so great when more plans started offering it, but sort of like what you described, sometimes it was almost easier when everyone that came in was like, all right, I guess I got to save up and do what I need to do. And now sometimes you'll have someone with coverage, but their insurance means they have to do X cycles of this first, or, oh, they haven't had this full year, even when we know that there's these other reasons that they're very unlikely to conceive without medical intervention. So sometimes you're right, it's almost harder when someone's like dangling that coverage over you, but saying you can't access it yet and you have to wait. And that can make people feel so powerless at a time that they already feel really out of control. So I think that's probably also part of the reason people benefit from your services, because at least one thing you can try and have some control over, even if you're waiting, is what you're doing to help your body in the meantime.
Yeah, exactly. And, I'm always, if someone comes to me and they're saying, okay, I need help with preparing for IVF and it's going to be happening sometime next year, I'm like, great, brilliant, let's work on that, because we've got the time to work on it. But sometimes people say, okay, I start my injections next week, what can we do? And it's like, not much. Like, I can give you emotional support, but there's not really much that we can do to change things in terms of your physiology at that point, right? So I'm, as far as my work is concerned, then the earlier people come to me, the better, because these things can take time, and it can take time to troubleshoot and to work through labs and to, really try to optimize things. And we know that, even if we're looking solely at the health of the egg and solely at the health of the sperm, it takes time to work on those things, right?
It's amazing that you had a year-long course to specialize this. I think back to
I was just going to say that. I'm like, which course is this? Like it feels like that there's a big separation between fertility care and nutrition, holistic, like whole person care. Well, just in the United States, it just seems like that in general, that it tends to be kind of like pick and choose. Like if you have like a GI issue, you see a GI doctor. If like you need a tonsillectomy, you see an ENT. So is it like that at all? Do you feel like there's any kind of focus on more holistic care where you're at?
I would say, again, it's luck of the draw. Some clinics, some NHS clinic, National Health Service clinics, and because we have private clinics as well, right? So some private clinics are getting more on board with that side of things, and are allowing, some clinics even have in-house nutritionists now, and not NHS ones, but private ones. So it's baby steps in the right direction. But I would say that definitely for me, one of the drivers for leaving the National Health Service in the first instance, and for kind of leaving my full-time nursing role behind, was that frustration that things in the healthcare system operate in silos. And so it's even when I worked on the gynecology ward, it was like, oh, well, yeah, if we see something up with your blood work, then, we're going to bring the haematologist in, or, then you've got the oncologist for this, and you've got the gastro for that. And so everything is almost like people are looked at within just like which system of the body is going wrong. And so actually we know that the systems in the body all speak to each other, and so many of them interact.
Especially when it comes to pregnancy, trying to prepare and then grow everybody. Yeah.
Every cell in your body. Yeah.
Yeah, every cell in your, it's the immune system. It is the gastrointestinal system and the microbiome. It's it's the reproductive tract, but then that sits on an axis with the brain and the thyroid and, the ovaries and the adrenals. They all speak to one another. And so we can't, I always have to say, I get very frustrated when fertility investigations are just a day 3 hormone test, and it's like, oh, well, that's normal, so you're fine. And it's like, well, actually, there's a lot more that we could be looking at than just your day 3 hormones to check fertility. So it's frustrating that things do operate in such silos, and everything is viewed at completely separately to one another. And also the fact that within all of those systems in the body, there's a person, right? It's not just a collection of systems, and it's not just the way those systems interact. It's that there is a real person with a life at the end of that and contained within that, and they are living that experience. And I think that that's often overlooked.
Right, and they have choices to make. It's not like a lab rat condition where you're being fed slurry 1 versus slurry 2. Like every single day is choices, and there are many choices that are now presented in our modern society that we maybe know at an intellectual level aren't good for us, but are very hard to not still just go along with. So
absolutely.
Talk a little bit about what do you do in your practice? How do you try and provide this more comprehensive fertility care?
Yeah, so I always say, look, working with me is complementary to any medical care that you might be receiving, right? So a lot of the time, I always think that my best work is done when it feels like there's a team around that person, and that team might look like their primary care provider. It might look like their fertility clinic. It might look like someone else they're working with, like their acupuncturist, or and then it feels more secure for that person. And I do always love it when we're talking to one another. So I wanted to say that first and foremost is that I always feel better when I'm working in a team. But having said that, if someone is just coming to me, then the first place I always start is by doing comprehensive blood work. And that's because of, going back to what I just said a minute ago around just checking the day 3 hormones, or even just checking the progesterone, the day 21. It gives us a little bit of information, but at the end of the day, hormones are just chemical messengers. And I often find that working on everything else in the body, that if hormones are out of balance or aren't giving the right messages or talking to each other in the way that we hoped, a lot of the time it's actually, okay, well, let's work upstream of that. Well, let's work on everything else. And then the hormones will often rectify themselves. So I will always, do comprehensive blood work, and that will look like all of the sex hormones. We'll look at cortisol as well to check on stress hormones. We'll look at the thyroid comprehensively. We will look at a complete blood count. So we'll see what all of your red blood cells are telling us and your white blood cells, because that can start to give us clues as to whether there's some nutrient deficiencies going on, or whether there's, whether your cells are oxygenating properly, and whether the immune system might be under a little bit of strain. And then we add in cholesterol, because we know that cholesterol is the precursor to all of our sex hormones. So we look at things from that perspective. And we also look at cholesterol because if cholesterol is out of balance in the way that typically a lot of people in the Western world might be, as in their kind of bad cholesterol, if you like, is on the high side, and that can be a precursor for a lot of people for a lot of the metabolic diseases that we see in the modern world, then that's a strain on the body. So whilst it might not directly link to fertility, what we want to see is a body that has as little strain on it as possible. I'll also look at vitamin D, vitamin B12, folate, and so it's an iron as well. So it starts to build this really complete picture of what all of the, systems in this person's body are telling us. And that then helps to give us clues of where we need to focus our attention.
It's like, this just came to my mind, and I'm so going to use this with a patient now. It's like the 6 degrees of Kevin Bacon, of where you're like your hormones. There's always some way that it eventually comes back to that. So like, gut health, that's something that we're starting to find impacts our hormones and our mental health and all sorts of things. So it's like, even though there might not be a direct connection, eventually somewhere down the line, you will eventually meet Kevin Bacon.
Yes. Right. I love it. I love that analogy.
When I'm into the Marvel universe, so in the latest Guardians, like Kevin Bacon's even in outer space now. So yeah, Kevin Bacon is everywhere. So that does make sense.
Is that the Christmas one?
The Christmas one, exactly. So even aliens know about Kevin. Because at first I was like, wait, are they going to know who Kevin Bacon is in the UK? But I'm sure they do. So
yeah, if the aliens know, we know. Yeah,
if the aliens know. If the aliens know.
And you mentioned in the intro the whole 1,000 days. Talk a little bit about that concept, because I think that's also a huge thing.
Yeah, I think given my backgrounds across my career of starting out in gynecology and women's health, and then ending my nursing career working with families, like I just told you, and working within that new mum and during pregnancy. So much of the training I had for that role was around the first 1,000 days of life, and that being from conception to age 2. And what we know about that first 1,000 days of life is that it dictates or predicts so much about our future health outcomes, our emotional intelligence, even, things like what our future educational attainments might be. And so that first 2 or kind of 2 years and 9 months, if you take the pregnancy stage into account, is so important for our health as humans, right? And so in terms of, if we look at things on a global scale, and if we look at things, again, the way the modern world is heading, there are just so many things about our modern lifestyles that are detrimental to health and well-being. And actually, by concentrating on that first 1,000 days of life, so it's about fertility, and it's about helping people realize their dream of becoming parents. But then within that, it's like, okay, well, yeah, you're also having a baby, right? And you're bringing a new person into the world. And what happens in that time really, really matters. And that, for me, is so much of what it's about.
It's true. All these things don't end when you have the baby. Like, you're trying to still be
still really important.
Care. And now you're trying to have to control what they eat when they're not inside of you, which is even harder.
Yes.
So.
Yes.
Yeah.
And it impacts society eventually. If we're creating healthier humans, eventually we're going to have a healthier society. This is that epigenetics that we talked about in a few episodes ago. And this is why it's so important for the nutrition and all the lifestyle stuff, that not only before we create that conception and that pregnancy, but during and afterward.
Yeah, exactly.
If you have somebody coming to see you, how do you take them as an individual and kind of personalize their care to make sure that you are, addressing things in a way that is specific to what they need?
Yeah, so I do that in a number of ways. And one of those ways is it's 3-pronged, I guess. And the first prong is in-depth clinical assessment. So when I first see someone, our first appointment will be 90 minutes long. Ideally, if it's a partner relationship, then I will be seeing both partners, because it takes 2 to tango. It's, so many times it's only women that come to me, and I will always say, look, if you're not doing this on your own and you're doing it with a partner, then really we need to look at both, because even if you have a known condition like endometriosis or PCOS or anything like that that we know can impact female reproductive health, we could do all the work on you and then find out that there's something going on with him later. And so my preference is always to work with both partners. And that first session, so I will do a 90-minute consultation with each partner.
Oh, wow.
And, you know, what do you get in a medical office? I mean, over here in the UK, a primary care appointment is 7 minutes now.
Oh my gosh.
Wow, we feel so like luxurious with our 15-minute and mini primary offices then. Wow.
Oh wow. I don't even know how that's possible to even get the amount of information to know what's even happening with somebody.
Yeah, I know, right? And I mean, in the pandemic, that was even worse because everything was by phone. And so you would maybe get, 5 minutes by phone.
Wow.
I felt really privileged because I know for me, if I need to see something, I know what I need. And so I have the kind of relationship with my doctor where I can say, this is what I need. And they'll say, okay. But that's because I know, right? And most people aren't in that privileged position. And so it's a really comprehensive look, and we will talk through in that 90 minutes. We will really go into the ins and outs of that person's health history. We will talk about all of the systems in their body. And I want to know what their gastrointestinal health is like from top to bottom, right? Because, you spoke about the gut earlier, and the gut is so integral to my work because it impacts our nutrient absorption. So we could have the best diet in the world, but if we aren't absorbing our nutrients so well, then it's going to be not pointless, but it's not going to be doing them that good. And then what you were saying about that interaction between the microbiome and the hormones like the estrobolome and how the microbiome impacts our estrogen metabolism. I want to know about these things. So we'll go into depth about their gut health. We'll go into depth about their immune system, about their family history, about their life in general and what their day-to-day looks like. Because the second prong to my approach that makes it individualized is I don't have a uniform set of recommendations that I'm making. And the reason for that, and I wrote a blog on this recently, actually called Why I Don't Think There's Any Such Thing as a Healthy Diet. And that is because it has to be bespoke to that person, because it's all well and good me turning around and say, okay, completely change your whole diet. We're going to go for this beautiful Mediterranean diet. You're going to have this, that, and the other. And they could turn around and say, well, okay, fine. Well, I don't like fish. I hate green vegetables. I work 15-hour shifts. And so, blah, blah, blah. And so we need to actually we use the science of behavior change in creating really bespoke recommendations for them.
I love that phrase. I'm going to steal that, bespoke. It makes it sound so much fancier. It's not saying I'm giving you a meal plan. I'm giving you a bespoke nutrition guidance. It sounds a lot more luxurious that way.
Sure does.
Yeah, absolutely. And it is that, because what we will do, I'll see people on a really regular basis. And I guess there's a coaching element to it, because we'll talk through like, okay, where are you at? Like, how has this week been for you? What have you successfully implemented? What have you really struggled with? And so much of it, I think, is about removing the shame from the process, because it is hard to change, right? And if your diet and lifestyle looks very different in practice to the way that, it should look in an ideal world, then we're going to need to take really gradual baby steps to get you there, right? Because what I don't want and what I try to avoid is a yo-yo diet mentality around this, and this idea that, okay, well, just give everything you love up for this 3 months and then magically a baby's going to happen and we'll be fine, and then you can go back to your old way of eating, because that's not helpful for anybody. And, for a lot of people who are on a fertility journey, they're in it for a long time. I was in it for a long time, and a lot of people are, right? It can be a really slow process. And what we want to create in our work together is something sustainable, and changing habits permanently, and changing habits in a way that feels really good, and changing habits in a way where there's balance and that life can still be enjoyed and you feel good, because it's not I'm on the diet or I'm off the diet. It's okay, this is what I move towards and I feel great doing that.
Yeah, and that's such a good point, because, nutrition and what we eat does not occur in a vacuum. We can tell you like XYZ is the best foods for you, and this is what you should eat, and this is the pattern you should eat. But culturally, we all have different cultural tendencies for what we eat, what preference is, like you've mentioned, even just nutritional deficiencies, things that we need to focus more on. So it's kind of impossible to just, put a label on somebody and say, like, this is exactly what you need without learning a little bit more about them. And if you tell them to do XYZ and you don't take into consideration any of those things, it's not going to work,
Yeah, exactly. And I always think if a client comes to me and they haven't done any of the things that I recommended, it's not their fault, it's my fault, because I haven't found a way through with them to actually, help them and support them to make those changes in a way that feels good and is meaningful for them.
Yeah, if it was easy to do in our modern world, we would all just be doing it. We wouldn't have all these challenges. Like, it's very stacked against us in terms of the lifestyle that we lead, with many of us in terms of jobs and the food availability and the time. So I think you're right. These really small baby step changes, that's what we've been talking about for almost 2 years now on the podcast.
Yeah. So. Yeah, and we know that's what works, right? When we look at neuroscience and the science of behavior change, that is what works. And I think that so much about, this is perhaps getting on my soapbox a bit now, but it's so much of what women in particular are exposed to through the lifespan is around dieting. And so much of our self-worth is tied up into our, our perceived body image and a lot of the time our food choices as well. And, so many people come to me and they're caught in binge eating cycles because there's so much shame tied up in what they're eating, and they end up, really, really trying their hardest and then falling off the wagon and then kind of going binging and then feeling really bad about themselves. And that's just not helpful for anybody. We want to do this in a way that actually feels good.
Yeah, there is so much shame when it comes to behavior change and nutrition and things like that, because we don't want to admit that maybe our habits aren't the best, even though we might know that. But also at the same time, we don't have that support to help us through, to even realize maybe some of the patterns we're going through, like that binge eating kind of thing, are actually being more harmful than what we are trying to do.
Yeah.
And that nobody's the best. I don't think even Gwyneth Paltrow eats the best. I think I have some concerns with her.
I have some concerns about her.
Yeah. So it's like there is no perfection. There's like the reality for you and what's going to work in your life. And like what you said, it's very, very needs to be long-term sustainable, because when you do have a 2-year-old run it around, like you're going to have to think about these just lifelong patterns, and every day is going to have days that you feel amazing and then days that you just did what you did to get through the day.
Yeah.
So,
yes. And days you don't want to cook, like there are several days I get home and I'm like, I'm not cooking tonight. Like, I don't care what we have, but I'm not doing it.
I know. Just before this, I was doing a pregnancy ultrasound and they were asking me, they're like, now we want to be very careful because she's pregnant. Is it best to just always cook in the house? I'm like, well, yeah, it's always best. If we could always cook all of our own nutritious meals, like that would be amazing. But most of us don't have that. So like, here are the things to think about with food safety when you dine out. But it's like, the reality is life is very complicated right now. And so it's these small steps and small choices. And I think you're so right to tie it to the things that make you feel good and how, you notice after you start making some of these changes, the feedback in your body. And that is its own reinforcement, which is much more of a reinforcement than that shame cycle when you're only doing it so you don't feel bad about yourself later.
Yeah, exactly. It does. And when you start to create those changes in a really sustainable way and you're doing things in a targeted way, then as you say, you feel better. Like you feel good. You've got more energy, and your mood might be better, and all of these other lovely things start to happen. And you're like, oh, gee, okay, this is good, and I like doing this, and I want to do more of it.
Well, this has been amazing. Thank you so much for sharing your time. I could listen to you and your lovely accent and your good advice all day. But this has been, so on track with the things that we love to talk about. And thanks for coming with us today.
Thank you for having me. It's been a pleasure.
Thanks for joining us for this week's episode of the Whole Pineapple Podcast. We hope it was helpful.
If you know someone who could benefit from hearing the podcast, we hope you'll share it with them.
And don't forget to subscribe, rate, and review The Whole Pineapple on your favorite podcast app. Every rating and review makes us easier to find.
This podcast is sponsored by Seattle Reproductive Medicine and is produced by Audiotocracy Podcast Production. We'll see you next time. Have a delicious week.